Good evening, good morning, everyone. So it's really great to talk to you today, and to many of you whom I know from different experiences. First of all, I want to thank the organizers, especially Dr. Renuka Jayatisa, and also who's the regional coordinator of IGN in the region. Also want to acknowledge the presence of Dr. Pandav, who has been a great leader in this effort of elimination of iodine deficiency in South Asia. So I'll spend a few moments on explaining some of the work we've been doing to look at the situation in South Asia around iodine programs. And also I will reflect a little bit on the linkages, salt reduction and salt iodization, the topic for today's discussion. As Werner Schontig just mentioned, this slide actually shows this very important progress through the measurement of goiters. On the left side, you see the status in 1993, on the right side in 2019. And the bubbles represent the size of the magnitude of goiter, which is one of the clinical signs of iodine deficiency. And you see that the rates in the 1990s was very high. And on the right side, you see the shift over time that has happened and how low the goiter rates are today. And this is mainly through the salt iodization efforts. Also, we see on this slide that the status of salt iodization in the world is quite good. On average, 88% of households in the world have access to iodized salt. As Werner already alluded, salt iodization is one of the public health successes. Now this slide, let's look at the progress in South Asia. It's been huge progress in the last 20 years or so. And these lines represent coverage of iodized salt at household level, and you see that the lines are going up for almost all of the countries, and that represents the progress that has been made. Now, and here you see the individual coverage data for all the countries in the region, and the yellow lines is household coverage of salt with any iodine in it, and the purple ones is with adequate iodine in it, and you see that the rates are almost close to universal in most of the countries. And that is then also shown through the iodine status, measured through the iodine content in urine. And here you see also that all the countries are in the yellow range, which is the recommended level by WHO. So we see that all of the countries are in the safe category. But if you look at more closer to the different countries and look at the subnational information, then you see a lot of inequities. And just as an example, and not to point at Bhutan, but just to show the example of Bhutan, has a very high coverage of iodized salt, yet still there are 6 out of the 20 districts that have a coverage less than 90%. So similarly for the other countries, you see that at subnational level, countries are still struggling to reach everyone with the intervention. We looked in the landscape analysis at the legislation and regulations on salt iodization. All of the countries, except the Maldives, have a mandatory legislation, meaning that all salt needs to be iodized, all edible salt, and with a few exceptions, that includes household salt. In some countries, food industry salt is not specified in the legislation. And in some countries also salt for livestock is excluded or it's not mentioned. And the standards, which is important to look at, the iodization standards, you see that in the different countries, there are different standards, and this is particularly important for trade and flow of salt between countries. And here you see the standards at production and at distribution at market level. India is the main salt supplier in the region, and Bhutan, Nepal, and Maldives are entirely dependent on salt importation. India supplies salt to many of the countries, and also Pakistan, to Afghanistan particularly, and to other countries too. We also then looked at how is iodine reflected in policies and plans. This is important because we believe iodine programs cannot be standalone anymore. They have been, but they should not be. They should be incorporated into other nutrition plans and policies. And we looked at that, and um, in most of the countries, that is the case. In all of the countries, I should say. So that's a good sign. We also looked at if, and I'm sure my colleagues will reflect on that later, salt reduction strategy doesn't exist in the countries, and except for Pakistan and Afghanistan, there is a salt reduction strategy in all of the countries. And it's important that these two strategies are aligned. We also looked at coordination and management, and I want you to point at the orange boxes or circles. The challenges that we observed is that although the plans include iodine nutrition plans, they're often still not, the coordination management is not sufficiently integrated. And also the mandate is often not clear. What is the responsibility of the coordination and managers in the specific countries? And also you see that there is a lack of consultation meetings. Those were the main challenges that we identified. Now, this is a very crowded slide, but I just we went through some of the data around salt reduction initiatives. And again, I'm sure colleagues will also reflect on this. But particularly, we looked at product reformulation, so that's food products, where salt content is being adjusted downwards as one of the measures to reduce salt intake. And you see that in most of the countries, it's being planned. Also, consumer awareness is a very important component of salt reduction, and that's also planned in most of the countries. And also the food-based dietary guidelines reflects reduced salt intake. So those are good initiatives. And on the right side, you see that is also a lot of plans around labeling and display of color-coded bars on foods, etc. So it's good that these initiatives are planning and that they are happening. And what is particularly important is that we seem to be at the right time to look really at a very strong integration or alignment of salt reduction and salt iodization. We are at the planning phase in many countries. As part of this work of the landscape analysis, we also looked at the presence of processed foods, particularly those foods that carry salt and are consumed widely by the population. And we, for all of the countries, we look at what are the key salt-containing foods that are currently being consumed. And here you can see that baked foods and biscuits are universally consumed. Dairy products, also savory snacks, ready to cook, and convenience foods, condiments. You find them, of course, everywhere. And we also checked whether iodized salt was being used in the production of these or not. And we see that the data is not complete, but we see that everywhere iodized salt is being used, but also non-iodized salt is very commonly used in different products manufacturing in these countries. So just a few moments to spend on the alignment and the synergies between iodine programs and salt reduction programs. We believe it's very important to look at the reformulation of foods because we would like food producers to switch from non-iodized salt to iodized salt. That's very important in areas where iodized stable salt is not readily available, let's say in remote areas, and where processed foods are being available and can contain iodine. So that's a very important strategy for the salt iodization program. And also for the salt reduction program to reduce salt levels, the reformulation is a big topic. So we can join hands and see how we can, when the discussion takes place, to look at both issues at the same time. Communication and awareness raising is very crucial for both initiatives on awareness raising on iodine and the benefits of iodized salt, and also look at how that can be incorporated in the curriculum and health promotion curriculum of schools. And that's already happening in many of the countries. And awareness raising around reducing salt intake and the right foods to choose is very crucial. Monitoring, that's also an area where strong alignment and integration can take place, looking at iodized status and use of iodized salt in household level, and also looking at salt intake, salt content in food, etc. As Werner also mentioned, salt iodization is the levels of iodine in salt can be easily adjusted. It's technically not difficult at all. So when salt intake goes down, salt iodization levels can be adjusted upwards. So that's a very important point to keep in mind, that it's not a big issue that when salt consumption patterns change. So jointly plan, coordinate, and exchange information and align monitoring and to focus on reformulation of foods. Those are the main alignment issues that we see. So in summary, well, there are many more results from this landscape analysis, which will be distributed soon, but I wanted to focus particularly on the topic of this session. So the South Asian countries have scaled up programs that largely provide adequate iodine to the population. However, still some regions and people are iodine deficient. Program improvements are possible and are needed to reach the last mile, and an overall focus is needed to sustain the efforts and to ensure that the program is anchored into national health agendas. So the sustainability is very key. We also think that the inter-country collaboration and coordination is very important. Many issues are affecting different countries, and if you look at the exchange of and the flow of foods and salt, I think it really points at the importance of the regional agenda. And also technical assistance and information exchange can really benefit from working together. And work with salt reduction, I think, also works across different countries in a regional context. So we believe there's a big opportunity there. So let me pause here and thank you for this opportunity.